I'm Juliana. I'm going to be your student nurse today. I'm recording for class. Is it okay if I record you?
Yes.
Okay. So then I would perform hand hygiene. Can you confirm your name and date of birth for me?
Jake Pajari, 9/16/1997.
All right, perfect. So I'm going to be doing an ear, nose, and throat exam. It should take probably about 10 minutes. So the first thing I'm going to do when I walk in is assess the patient. Patient is sitting upright, is awake, alert, skin discoloration is normal, is expected for ethnicity. There's no labored breathing, no signs of distress. Grooming appears to be intact. So then I would assess the patient's radial pulse. So can I have your wrist? And I would do this for a full minute, or I would do it for 30 seconds and multiply by 2 for a full minute. And I would expect a range between 60 and 100. So let's say 72. I would do the same thing with respirations. I would count for 30 seconds and multiply by 2 and expect between 12 and 20 breaths. So we'll say 16. Are you experiencing any pain today?
No.
On a scale of 0 to 10, how would you rate your pain?
0.
Okay. So patient reports no pain. Do you know what town we're in?
Sterling.
Do you know what today's date is?
31st of March.
Okay, so then I would be able to say that the patient is oriented to person, place, and time. So before we get started with the ear portion of the exam, are you experiencing any hearing loss or decrease in hearing?
No.
Okay. So first thing I would do is inspect, so I would note that the ears are symmetric and I would do that by drawing the line from the eyes to the top of the ear. There is no drainage, skin coloring is symmetric, there's no obvious lesions. So then I'm going to palpate for tenderness, so I'm going to touch your ears and I just want you to tell me, is there any pain with any of that?
No.
So patient denies pain. So then I'm going to assess cranial nerve 8. So can I have you cover one ear? And I'm going to whisper a word and I want you to tell me what I said.
Popcorn.
And then can you cover the other ear?
Baseball.
So the patient has cranial nerve 8 is intact from the whisper test. So then I would do the Weber test, which I don't have a tuning fork, but what I would do is I would hit the tuning fork and I would put it on the top of his head and ask him if he heard it equally in both ears. So for the purpose of today's exam, we're going to assume that the hearing tone was equal bilaterally. So then I would use the tuning fork again to do the Rene test. So I would hit the tuning fork, I would place it right behind the ear until the patient stopped hearing it, and then I would move it next to the ear to see if they could still hear the conduction there. So we would expect that AC is greater than BC, so air conduction is greater than bone conduction. So then I would inspect the ear canal. So I would use an otoscope for that, but since I don't have one, I'm just going to use my pen light and just see what I can see on my own. And I would do that bilaterally. So there is cilia and cerumen present. I would expect the tympanic membrane to be a pearly gray. So now I'm going to move on to the nose portion of the exam. Before we get started, have you experienced any loss in taste or loss of smell?
No.
Okay. So I would inspect the nose. I would notice that it's located midline, no drainage, no obvious lesions. So then I would inspect inside the nose. Mucosa is pink and moist. Septum is also midline. Can I have you cover one nostril? and sniff. And then the other one. So nares are patent bilaterally. So then I would do the smell test. So I would have him cover one nostril. I would put something under his nose and I would have him close his eyes and see if he could identify the scent. So assuming he could do that, then cranial nerve 1 would be intact, which is the olfactory nerve. So now I'm going to palpate your nose for tenderness. Can you just tell me if there's any pain? Any pain?
No.
So then I'm going to palpate your sinuses. Any pain here?
No.
Any pain here?
No.
Okay. So patient denies tenderness in maxillary and frontal sinuses as well as in the nose. So then I'm going to move on to the throat portion. Is there any loss of taste or trouble swallowing?
No.
Okay. So I would note that trachea is located midline. Can I have you turn your head to the right for me? And I would inspect the jugular vein. There's no signs of JVD, which would be swelling in the neck. So then I'm going to inspect the lips, which seem to be dry and intact. There's no signs of discoloration, no malodor from his breath. So then I'm going to have you open your mouth so I can inspect your teeth. Teeth are intact, both upper and lower, and patient does not have any dentures. I also noticed while I was looking that there's no swelling of the gingiva. Mucosa is pink and moist. There's no lesions. So then I would check cranial nerve 12. Can you stick your tongue out and say ah? So tongue is located midline. Floor of the mouth is pink. So then I'm going to assess cranial nerve 9, which is the glossopharyngeo. So I'd assess this by noting that the patient's voice has been clear this far at this point through the exam. Can I have you stick your tongue out for me? Can you move your tongue up and down and side to side? Perfect. So cranial nerve 9 and 10 are both intact. Can I have you open your mouth again? So I'm going to look at your tonsils. Tonsils are +2 bilaterally. There's no redness or lesions. And that is the end of my exam. Do you have any questions before I go?
No.
Thank you for being my patient.